Is this coming from the midline to you? That's not midline. That's lateral. All right. Where is it coming from? Just under the midbrain. That's your fifth nerve. This is your fifth nerve, trigeminal nerve. And this one is going to be your seventh nerve because fifth and sixth and seventh nerve. Very easy when you look at it this way. This is your tentorium cerebelli. You have a free part. This is a free edge and an attached part anteriorly. Tentorium cerebelli. All right. Base of the skull, base of the brain. That's my favorite part. It's very simple and nice. We're going to answer the same things, the same structures that we answered before, but you're looking at it from a different angle. All right, let's look at that. That's your base of the brain from the anterior cranial fossa, olfactory tract, number 18. And then you have optic nerve, 21. Optic chiasm, 20. And then 22 is your optic tract. 25 is your pituitary, or the infundibulum of the pituitary. There is an artery related to the optic nerve, is number 12, is the internal carotid artery that divides into two terminal branches. And these are middle cerebral going through the sylvian fascia and anterior cerebral going interhemispheric. So number 2 is anterior cerebral. Number 15 is middle cerebral. Oh, hold on. What is that? These are two vertebral arteries coming together as prepontine artery. What is the prepontine artery? It's the basilar artery. And then goes up. What are the terminal branches of basilar artery? Two things. Posterior cerebral artery on both sides. So this is posterior cerebral artery. All right? This is the man. Who is the man holding the cigarettes? Two basilar artery. These are the legs. That's the body, basilar artery. And on the top, he has two fingers. 27, posterior cerebral. And 35, superior cerebellar artery. And in between is the third nerve, your oculomotor nerve. What is this one? This tiny branch, number 1, is your abducens nerve because it's coming from the pons in the midline. All right. So this is the base of the brain, basically. Just to continue, head and neck nerves, I think we talked about all of this. We talked about oculomotor nerve and that it comes from the oculomotor nucleus and it moves forward to the inferior and posterior cerebellar artery, the man holding the cigarette, and then it pierces the dura and into the cavernous sinus, subis into the wall of the cavernous sinus, and then leaves the cranium through the superior orbital fascia as we discussed before. It supplies all the muscles of the eye except SO4 and LR6. So it will supply all the muscles of the eye. And finally, if you have a palsy in the oculomotor nerve, the eye will be deviated downward and outward, and the patient will have ptosis and mydriasis. Downward, outward, ptosis, and mydriasis. And it's usually compressed against the petrous part of the temporal bone. Trigeminal nerve, again, we talked about trigeminal nerve very quickly.